Health, Education, Labor, and Pensions will please come to order. First, some administrative matters based on the advice of the attending physician and the sergeant at arms after we consulted with the Department of Health and Human Services and the Centers for Disease Control and Prevention. Individuals in the hearing room are at least 6 feet apart. As a result, there's no room for the public to attend in person. Representatives of the press are working as a pool to relay their observations to colleagues. The hearing may be watched online. An unedited recording will be available on the committee's website, www.healthsenate.gov. Witnesses are participating by video conference in a one-time exception. Some senators, including the chairman, are participating by video conference. Senators, we've been advised, may remove their masks, talking to the microphone when they're in the hearing room as they're 6 feet apart. I'm grateful to the Rules Committee, Sergeant at Arms, the Press Gallery, the Architect of the Capitol Police, committee staff, Chun Sheck and Evan Griffiths, all for their hard work to keep us safe. At our hearing last Thursday, I said that all roads back to work and back to school run through testing, and that what our country has done so far on testing is impressive, but not nearly enough. Over the weekend, Senator Schumer, the Democratic leader, was nice enough to put out a tweet quoting half of what I said. He left out the other half, the impressive part. So let me say again what I meant by that. When I said impressive, I meant that according to the Johns Hopkins University study, the United States has tested over 9 million Americans for COVID-19. That's twice as many as any other country. We don't know what China has done. And it's more per capita than most countries, including South Korea, which many members of our committee had cited as an example of a country that had tested well. According to Dr. Deborah Birx, the United States will double testing in the month of May, which should get us up to about 10 million tests conducted. Now, here's what I mean by impressive here in Tennessee, where I am today. First, anyone who's sick, first responder or healthcare worker can get tested. Our governor, Bill Lee, is also testing every prisoner, every resident and staff member in a nursing home. He's offered weekend drive-through testing. He's done specific outreach for testing to low-income communities. A Tennessean can get a free test at the local public health department. The governor's slogan is, if in doubt, get a test. Governor Lee sent his testing goals in May to the federal government, as every state has done. Federal government is helping him make sure that he has enough supplies in case he has trouble getting them through the labs and the other commercial sources. As a result, our state has tested about 4% of the population. The governor hopes to increase that by 7% in May. That's one of the best in the country. This impressive level of testing is sufficient, we believe, to begin phase one of going back to work. But as I said last week, it's not nearly enough to provide confidence to 31,000 students and faculty members who we hope will show up at the University of Tennessee campus in August when school starts. Last week, I talked with UT Knoxville Chancellor Dondi Plowman about that. We said, what would persuade those 31,000 students, as well as the 50 million K through 12 students in the country and the other 5,000 university students, what will persuade them to go back to campus in August? That's where the new Shark Tank comes in. Dr. Collins at the National Institutes of Health calls it RADx. We had our hearing about that on Thursday. It's a really remarkable scientific exercise to take a few early stage concepts that are swimming around in what we call that competitive Shark Tank and see if Dr. Collins and his associates can find a few new technologies to create millions of new tests that will scale up rapidly and make it more likely that students will go back to school in August. For example, the FDA authorized last week its first diagnostic test using saliva that a person provides at home instead of a nose swab or blood. It authorized its first antigen test. We're hearing a lot about those, like the ones used for flu or strep throat, which involves the swabbing of a nose and you can get the result in just a few minutes. Another proposal, not yet approved, is to put in your mouth a sort of lollipop sponge. Take a photo of that with your cell phone and send that to your doctor. If it lights up, you're positive. Or the university might send that saliva lollipop to a nearby laboratory, which uh, could be a gene sequencing laboratory, which can deal with thousands of those samples overnight. That same process could occur at a middle school. It could occur at a factory. Of course, anyone testing negative one day can test positive the next, but such widespread screening of entire campuses, schools, or places of work will help identify those who are sick, trace down those who are exposed, and that in turn should help persuade the rest of us to go back to school and back to work. In addition to more testing, I expect Dr. Fauci talk to us about additional treatments that will be available to reduce the risk of death, and the administration's plan to do something that our country has never done before, which is to start manufacturing a vaccine before it actually has been proven to work in order to speed up the result in case it does work. Those vaccines, those treatments are the ultimate solution. But until we have them, all roads back to work and school go through testing. The more tests we conduct, the better we can identify those who are sick and exposed. Then we can quarantine the sick and exposed instead of trying to quarantine the whole country. Now, in my opinion, this will require millions of new tests, many from new technologies. Some of these will fail, but we only need a few successes to get where we want to go. That's why I said on Thursday that what our country had done so far in testing is impressive, but not nearly enough. First, squeeze all the tests we can out of current technologies. Next, try to find new technologies to help us contain the disease and persuade us to go back to work. Now, one other thing. This is a bipartisan hearing to examine how well we're preparing to go safely back to work and to school, and to determine what else we need to do in the United States Senate. Such an exercise sometimes encourages finger pointing. Before we spend too much time finger pointing, I'd like to suggest that almost all of us, the United States and almost every country, so far as I can tell, underestimated this virus, underestimated how contagious it would be, underestimated how it can travel silently in people without symptoms to infect other people, how it can be especially deadly for certain segments of our population, the elderly, those with pre-existing conditions, minority populations. Let me go back to the March 3rd hearing that we had in our committee on coronavirus. 6 weeks after the first case was discovered in the United States, a day when only 2 deaths were recorded in this country, I read at that hearing this paragraph from the New York Times 2 days earlier on March the 1st. They reported this: much about the coronavirus remains unclear, the Times reported, and it's far from certain, this is March 3rd, March 1, that the outbreak will reach severe proportions in the United States or affect many regions at once. With its top-notch scientists, modern hospitals, and sprawling public health infrastructure, most experts agree the United States is among the countries best prepared to prevent or manage such an epidemic. That was the New York Times on March 1. A lot of effort has gone into trying to make our country well prepared. Over the last 20 years, 4 presidents, several Congresses, in response to 9/11, bird flu, Katrina, Ebola, H1N1, MERS, passed 9 major laws to try to help get this country ready for what we're going through today. These laws stood up the Strategic National Stockpile, created an Assistant Secretary for Preparedness. It created incentives for the developments of vaccines and medicines that we're using today, strengthened the Centers for Disease Control, created BARDA, thanks to the leadership of Senator Blunt and Senator Murray for 5 straight years. We've significantly increased funding for the National Institutes of Health. All this was part of a shared goal. Democrats, Republicans, 4 presidents, several Congresses, to try to get ready for what we're going through today, whether it was known like anthrax or unknown like COVID-19. But despite all that effort, even the experts underestimated COVID-19. This hearing is about how we improve our response to this virus as well as the next one. During the oversight hearing, I also intend to focus on, as I just said, the next pandemic, which we know is coming. What can we learn from this one to be ready for the next one? What can we learn from the fast tracking of vaccines and treatments that we're about to hear about that will make it even faster the next time? How can we keep hospitals and states from selling off protective equipment when their budget gets tight? How can we make sure Congress does our share of the funding responsibility? How do we provide enough extra hospital beds without canceling elective surgery, hurting other patients, and bankrupting hospitals? Whose job should it be to coordinate supply lines so that protective equipment and supplies get where they're supposed to go when they're supposed to go? What's the best way to manage the stockpile? My preacher once said, "I'm not worried about what you do on Sunday, it's the rest of the week that concerns me." I'm afraid that during the rest of the week between pandemics, we relax our focus on preparedness. We become preoccupied with other important things. Our collective memory is short. Just 3 months ago, this country was preoccupied with impeaching a president. Now that seems like ancient Roman history. Now, while this crisis has our full attention, I believe we should put into law this year whatever improvements need to be made to be well prepared for the next pandemic. If there is to be finger pointing, I hope they're pointed in that direction. We're fortunate today to have 4 distinguished witnesses who are at the heart of the response to the coronavirus. We're grateful for their service to our country. I've asked them each to summarize their remarks in 5 minutes. Then we'll have 5-minute round of questions from each senator. I've agreed we'll end our hearing about 12:30 after we have a full round of questions. Every senator will have a chance to have his or her 5 minutes. Senator Murray will then have an opportunity to ask the last question or to close the hearing, and I will then close the hearing. There will be other hearings to follow this hearing, like last Thursday's hearing, and senators may submit their questions in writing within the next 10 days. Staying at home indefinitely is not the solution to this pandemic. There is not enough money available to help all those hurt by a closed economy. All roads back to work and back to school lead through testing, tracking, isolation, treatment, and vaccines. This requires widespread testing. Millions more tests created mostly by new technologies to identify those who are sick and who've been exposed so they can be quarantined, and by containing the disease in this way, give the rest of America enough confidence to go back to work and school. For the near term, to help make sure those 31,000 UT students and faculty members show up in August, we need widespread testing. Millions more tests created mostly by new technologies to identify those who are sick and who have been exposed so they can be quarantined. By containing the disease in this way, give the rest of America enough confidence to go back to work and back to school. Senator Murray.